Could you be losing key Medicare Advantage benefits in 2025? Are things like over-the-counter cards and gym memberships suddenly going to be off the table? How are different Medicare insurance companies reacting to changing market forces? So we're going to dive into all these things in this video. My name is Ken. I'm a licensed broker with NJ Life and Health. We are a brokerage that has helped thousands of people with their Medicare over the years in about 24 different states, so all across the country. And we're going to be using our expertise to help you understand what might be changing with Medicare Advantage plans in 2025. Let's dive into it. All right, so today we're going to be reading an article together, and I will be filling in and giving you guys more information as we go. But this is the title of this Wall Street Journal article. Your Medicare plan might not include as many freebies next year. Insurers are likely to favor margins over growth, meaning benefits such as gym memberships might go. So we're going to dive into this. The next paragraph actually explains what I'm going to talk about first, but really the big hook point for everyone watching to know is all these Medicare Advantage plans might have less perks next year. So let's dive in. So Medicare Advantage is facing a bit of a disadvantage. The private plans have grown in popularity in recent years because many seniors like that they come with no monthly premiums and offer extra benefits, including vision and dental coverage as well as fitness memberships. It also doesn't hurt that the plans are marketed aggressively. Now, though, the industry is contending with pressure on both cost as seniors who held back on procedures during the pandemic rush back and revenue as the Biden administration curtails payments to plans. So the first thing we'll talk about is Medicare Advantage. Medicare Advantage is a private equivalent to original Medicare, and because it's a private equivalent and not original Medicare, they're able to offer benefits that original Medicare doesn't offer. Now, this can start with more basic healthcare stuff like dental and vision, and can also move into territories like gym memberships, over-the-counter cards, even money back on your Social Security check. So a lot of people like these plans because they're getting all these extra benefits they wouldn't get with original Medicare. On top of that, no monthly premium. This is a bit of a misnomer. There are ones that do have monthly premiums, and you still have to pay your Part B premium in most cases. So it's not like there's no monthly costs at all. They're also marketed aggressively. I got to imagine that you and everyone you know saw a gazillion commercials talking about these plans during annual enrollment. As this market has expanded, as these plans have expanded, the companies are now starting to, think about, are we going to continue to offer all these services, especially as Biden is looking to potentially cut payments? So that's something big to know. The more challenging financial picture means companies will need to make some tough decisions about their plans next year, either sacrifice profit margins to continue growing or pull back on benefits to boost profitability. While there are other factors at play, if the current trends continue, plans will have to be more cautious in their offerings going forward. So there's a really cool graph here that we can all look at together where it shows in 2007, the market share of Medicare Advantage plans was about 19%. So people on Medicare were 19% enrolled. Flash forward all the way to last year, 2023, and it was a whopping 51%. So a little over half of the entire Medicare market is now on a Medicare Advantage plan. Companies like these plans, as I stated earlier, because they are more profitable than other Medicare offerings, and they have been marketing aggressively to expand this market share. So they've basically hit their goal. They've gotten a massive amount of the market to be in these Medicare Advantage plans for different reasons. So this article details, well, do they continue to try to expand, or do they cut their offerings and take this 50% market share and make it more profitable to their bottom line? At this point, it looks pretty clear that next year's reduction in benefits is really going to reduce enrollment growth, says David Winley, an analyst at Jefferies. In their most recent earnings report, health insurers sounded the alarm on higher medical costs, though there have been some notable differences. Humana, a Medicare pure play, as in they only offer Medicare policies, warned that the higher cost trends could persist for some time. United Health Group, the industry leader, has signaled that the rise in costs is partly because of seasonal factors such as seniors seeking RSV vaccinations. How the next few months play out will determine what course insurers take as they bid for 2025 plans by June. So there's a lot of money in Medicare. There's billions upon billions of dollars in this industry. The only downside for these big companies is they do have to factor in the cost of senior health care. Seniors are statistically more likely to have things go wrong with them. It just naturally happens as you age. So these older adults do have higher medical bills. So it becomes this, tug and pull of, okay, we want to expand as much as possible, but they also don't want to incur so many healthcare bills from these older adults on these Medicare plans. And, there's also people under 65 on Medicare as well. I can't leave them out. So they're trying to find the balance, because Humana, which I believe will get detailed later in this article, had a very bad earnings report because they just had too many medical bills. So they were dealing with issues in terms of just saying, our profits, our revenue was not what we thought it would be, simply because we were paying too many medical bills. So it's almost like they're like, oh, we want everybody, but oh yeah, we forgot we actually have to, pay some bills in the process. So we'll dive into that here. Humana is at the eye of the industry storm. Its stock is down nearly 20% this year after the company disclosed higher than expected medical costs. Not helping matters is the fact that the newly released 2025 rates proposal from CMS, Centers for Medicare and Medicaid Services, reflects what insurers say is an effective decline in payments. The rates offered by CMS to plans typically go up after lobbying from insurance giants around this time of year, so the industry's talk of cutting benefits should be seen as part of an effort to prod CMS to increase rates. All right, so what are they talking about here? So Biden has signaled that he wants to lower payments to Medicare Advantage companies. What are these payments? So just to be transparent, so when someone signs you up for a Medicare Advantage plan, or you call the company directly and you're enrolled, the federal government will give the insurance plan you signed up for $12,000 to manage your care. Now, it's give or take. It could vary depending on the state. It could vary depending on a bunch of different things. But let's just say $12,000 as an arbitrary number. Biden is looking to curtail that amount. So usually it goes up a little bit year over year. Biden is saying we need to stop this growth, and the insurance companies are saying we don't want any of that. So the author is pointing out here the costs are going up, but this could be a bit of a public PR campaign as well. But pressure from Wall Street also plays a role. CVS, a parent company of Aetna, acknowledged the margin pressures in its earnings call. Last year, CVS was aggressive in expanding benefits to attract new members, which helped it add 800,000 Medicare Advantage plan enrollees. Many of these new members switched from other plans. During an earnings call, United Healthcare Medicare and Retirement CEO Tim Knoll said, "We probably saw one of the more aggressive years of pricing that we've ever seen." He was no doubt referring to CVS. So CVS made a big move to get more people into its Medicare policies, specifically Medicare Advantage policies, and took, a lot of people from other companies. But at the end of the day, that does come at the cost of you have to make these plans more enticing to people, which means that you're not making as much per person as they enroll. But the higher than expected medical costs are eating into profits, prompting CVS to cut its 2024 earnings per share outlook, while acknowledging that its Medicare business will only be marginally profitable in 2024. So all these companies are running into the same exact problem, it seems, which is they're trying to get everybody into these Medicare Advantage plans, and they're trying to really expand their market and get more and more people. But people are getting older. They're needing more medical care. People are staying alive for longer periods of time. And even though you are living longer, it doesn't necessarily mean that you're not going to be without your health issues. So it looks like they miscalculated a bit. They said, let's get everybody on the books. And now they are dealing with the repercussions of having to actually pay people's medical bills. They're not super excited about it. Cigna, which is getting out of Medicare Advantage, is a Wall Street favorite. So Cigna actually is getting out of the Medicare business. And when they announced this and the sale went through, which is taking place in 2025, their stock went up 11%. Now, Humana, who is Medicare only, is dealing with some issues here. Their stock's down 20%, a low of 22%. As they have come out and said that Medicare is costing them more and more money. So, Wall Street is putting a little bit of pressure on these companies to not focus on Medicare quite as much, as they're realizing how many costs go into managing these Medicare plans. We are first and foremost focused on recovering margin, and market share gains is a secondary consideration, said Brian Kane, president of Aetna, the CVS Health Services arm. Elizabeth Anderson, an analyst at Evercore ISI, says that while some benefits might have to come down next year, CVS's improved star ratings, which can bring bonus payments from CMS, will help its Medicare business become more profitable next year. So what the president of Aetna and this analyst are saying is, we've expanded our market share a lot, and we're happy with the amount of people we have. Now we have to make each person more profitable. So this is where we come into the idea that the video started on, which is they might have less benefits. So we talked earlier about how each Medicare Advantage plan gets about $12,000 per person they enroll. If they suddenly take away your $300 a year over-the-counter benefit, that's $300 extra they get. If they suddenly reduce their dental benefit from $2,000 to $1,000, that's another $1,000 they get. They're saying, we've expanded, we've gotten people into these plans, now it's time to start cutting things in order for us to make more money. While there is a lot of posturing in the health insurance business, it is at least fair to say that there is a real cooling of what was once a gold rush. Cigna recently sold its Medicare business after calling off talks to purchase Humana, much to the relief of Cigna shareholders, and its stock is one of the few in the industry being rewarded. Others are pressing the pause button. We're in the position of not trying to grow Medicare Advantage, said Centene Chief Financial Officer Andrew Asher. We're trying to ultimately recover margin in the back half of the decade, and so we'll adjust the bids accordingly. These are two awesome paragraphs to dive into. There was indeed a gold rush with Medicare plans. It has been a massive business. It has been growing and growing, but it looks like we're seeing a bit of a market correction where there's a lot of players, there's a lot of money getting thrown around, and it's starting to cool down. These companies are now starting to say, okay, is it profitable? What can we do? They've been so obsessed with growth. Now they have to look around and say, okay, we've gotten 50% of people. What do we do now? Cigna said, we're getting out. We're not worried about it. And Centene, this is a big Medicare company. They own a bunch of different companies. They're saying the same thing the Aetna president said, which is, we're trying to recover margin. So this is huge. This is another big person in charge of a lot of Medicare enrollees saying, we're trying to recover margin, which means most likely less freebies, less benefits, less perks, and everything like that. Ultimately, Asher explained, that means plans might be a little bit less attractive for seniors. These comments are intended just as much for investors' ears as they are for bureaucrats at CMS. But the message is clear, Medicare Advantage plans might need to get a little skimpier next year. Sounding like a broken record, but the point remains the same. These big heads of these massive insurance companies are saying, we're not going to be offering as much when it comes to Medicare Advantage and all these Medicare plans and everything like that. Now, if you want to read this article yourself, I will link it down below. It is really great reporting, and it's awesome how they were able to talk to a bunch of different people in the Medicare space and figure out what they might be doing in the upcoming year. But I have a question for you. If you're on a Medicare Advantage plan, are you worried about losing benefits next year? Do you like your Medicare Advantage plan? Do you prefer original Medicare? We would love to know what your thoughts are in the comments. And if you have any topics or articles you think we should cover in the future, I'd absolutely love to know what your thoughts are on this and what else you think we should cover. So once again, I've been Ken with NJ Life and Health. If you ever need any help from us, feel free to visit our website at www.njlifeandhealth.com. We're licensed in about 24 different states and always happy to help you out when it comes to Medicare. So thank you again, like and subscribe, and I will see you in the next video.